Quick disclaimer here, guys, before we get started. This video is meant for educational purposes only and should not replace manufacturer guidelines or your organization's protocols. Always make sure that you understand how to utilize this pump before you utilize it on a patient, and always put patient safety first. If you have questions, be sure to always reach out to your nurse manager or consult with your organization prior to utilizing this pump. Thank you so much, and I hope you get a lot out of this video. This is a Finnick Media production, and today we will be discussing the Sapphire pump and how to utilize it in the home infusion. Just a quick recap of what we will be speaking on today. We're going to be discussing the tubing and the different types of tubing that you will see with this pump. We'll discuss priming that tubing via gravity, as well as priming on the pump. We'll discuss inserting the tubing into the device. And then we will also discuss the delivery modes that you will most likely see on these pumps, as far as continuous and the multi-step. We will also discuss some settings that you can change around on this pump to make your life a little bit easier when you're utilizing it. There will be timestamps in the description so that you can jump around in this video and really get the most out of it. There are two types of tubing that you're going to see utilized with the Sapphire pump. These are the two types of tubing that you will see. The big difference between the two different types is one type will have a drip chamber and will have a higher volume that is within the tubing, and then the other tubing will not have a drip chamber and will require less volume within the tubing, and will typically be what you see when you're utilizing it with IVIG. All right, guys, so this is the tubing that you're going to most likely see with your IVIG infusions. You'll notice that there's actually 5 parts to this tubing. The other big thing to note on this tubing is that it has a total volume in the tubing of 5 mLs. That's going to be important later when we get to the settings. So the 5 main parts of this tubing is going to be your spike. You'll notice that there's a vent on the side of your spike here. You also notice that there's this big gray thing which goes into the pump. There's a slide clamp, and then there's also the piece that goes to the patient. So the big thing with this is, like any other IVIG infusion, you need a vent anytime you're utilizing a glass vial. With this tubing, it already has the vent built into it, so you will no longer need to use a vented spike when utilizing this tubing. So you would take off your cap, spike your vial, and then you would have to open your vent to vent air into your vial as you are completing your infusion. You will also note that on the larger piece that actually goes into the pump, there's the outside and then the inside. You will note that on the inside of this tubing, or this part, there's this piece in the middle that is on a spring. And you notice that when it's lifted, that is closed, meaning that when you lift that up or let it lift itself up, then this tubing is locked and no fluid will flow through this tubing. You push in and down on that piece, and that locks the tubing open so that in this position, it will free flow and allow your medication to run. You also notice that there's a slide clamp that you can utilize whenever you're priming or using your tubing. But if it's not in the pump, you can always use this mechanism where you'll push up and out to lock the tubing, and then in and down to open the tubing. Big things to note when you're utilizing this tubing is that when you're attempting to prime this tubing, you really need to use the pump to prime this tubing. This tubing is going to be extremely difficult to prime via gravity. So when you are utilizing this tubing in particular, especially with IVIG, make sure you utilize the pump to prime your tubing for you. So this is the other tubing that you may see with the Sapphire pumps. You will notice the big difference with this tubing is that it has a drip chamber that we can utilize. The other thing is it's a much larger diameter tubing, and you will end up wasting a lot more medication with this, or you will have to flush the medication through this tubing to make sure that the patient gets a full dose. You'll also notice on the drip chamber that there is a vent on it as well, so you can utilize that vent anytime you're using a glass vial. Other than that, the only other big difference with this tubing is that there is an access port that you can utilize to inject medications with, and then there's also a slide clamp. This tubing is really good for utilizing it to give pre-hydration, because you can utilize this to do your pre-hydration and then connect your IVIG and then utilize your IVIG, and then if you need to do post-hydration, you can use the same tubing. But other than that, it's pretty much exactly the same. You'll notice that the part that goes into the pump, on the back side, there is again this little lever that when you push up, it goes up and out. That is the closed position. And then to put it back into the locked open position, you'll push in and down, and that will be the locked open position. When you're utilizing this as a gravity infusion for hydration or some other medication, you want to make sure that this tab is in and down and that this tubing is locked open, and then use your slide clamp to control your flow rate. That will allow you to count the drips in your drip chamber and then monitor your infusion. Now, the nice thing about this tubing is it is again a 20 drop per ml tubing. So you can utilize this tubing for all of the Finnick Health gravity infusion protocols, and then you utilize it for any of the pre or post hydration as well. But again, you may not always see this tubing, and most likely you will utilize the other tubing, especially for IVIG infusions. All right guys, so now we're gonna go over how to load your tubing into your pump properly. This is a device that we utilize for demonstration purposes only, and it makes it much easier for us to run the pump without causing issues or making a mess with fluid. But you will notice that this piece here is identical to the tubing and the tubing that you will be using when you are putting it into your pump. You'll notice on the back here, again, you have that little lever. If you push up and out, that's locked closed. And if you push in and down, that's locked open. You also notice that there's these notches at the bottom, and then these little notches at the top here. What you will do is you will take your pump. There's this clear portion that goes over the part that loads the tubing. You'll notice that there's kind of a rough edge. You're gonna push in and open that plastic door. Once you open that door, you're gonna take your tubing and you'll take those notches and you'll place them at the bottom of the pump. And then you're gonna push in until those hooks at the top load and hook onto the top portion of that plastic device that goes into the pump. Once it's securely in there, you're going to go ahead and close your door, and that is how you load your tubing into your pump properly. Okay, now we're going to go into the different modes that you can administer medication with this pump. So first thing we're going to do is turn the pump on. And you'll notice that it kind of goes through its startup cycle. And right now I have it set to already default into the continuous mode. You can tell what mode it is in by looking up here. It'll say continuous or multi-step. When you are in continuous and you are going to utilize the continuous infusion, you will need to titrate or change the infusion every 30 minutes manually. When you are in the continuous setting, you will not be able to just allow the pump to titrate your infusions for you. So when you are running an infusion in the continuous setting, you will always need to keep track of time and note when it is time to titrate that infusion. Okay, so once we have loaded our tubing and turned our pump on, you'll note that it comes to the screen. At the top here, you'll see in what mode that we are in. In this case, we're in continuous. And then what you can do is we're gonna go ahead and actually prime our tubing. Let's say that this is the micro bore tubing, and we are gonna be priming our IVIG with the pump. What you will do is you'll go ahead and hit prime, and it'll give you a warning. Make sure that your patient is disconnected so we're not priming air into our patient. And then you'll go ahead and hit prime. And you'll notice that there's a 2-minute countdown, and then it will go ahead and automatically prime your tubing for you. When this machine is doing this, we'll go ahead and make sure that we're paying attention to the tubing. And when we need to stop the infusion, saying that our tubing is completely primed, we will go ahead and hit finish prime. If this is a new infusion, you will go ahead and touch on new infusion. You will select always mLs, and then it will never be a weight-based dosing, at least for this pump. Then you will always select mLs per hour, and then you will come to the screen. What you will need to do is put the rate that you're going to infuse and then the total volume for that entire infusion, and then it will automatically calculate your time. So in this case, we're going to do it as an example of an infusion that starts at 25 mils per hour and goes up every 30 minutes to a max of 100 mils per hour. So we're going to start our infusion at 25 mils per hour. And then our total volume, we'll say that we're going to give 40 grams or 400 mLs. So we're always going to put in a little bit more. So we'll put 420, and then we'll hit OK. And then see that it automatically calculates our time for us. Once that's done, our tubing or medication has been primed, the patient's hooked up, and we're ready to start that infusion. We'll go ahead and hit OK. Then we'll go ahead and hit start. Now that infusion is actively running on that patient. Now, things to note here is that we're running at 25 mLs per hour, and there's a total volume of 420. This will also tell us how much medication has been administered and counts it down for us. Now, say 30 minutes has gone by and we want to titrate this infusion up to 50 mLs per hour. What you will do is you'll touch on your 25, and then you will hit 50, and then hit OK. It's just a warning. The pump is warning you that it's going to go from 25 mLs per hour to 50 mLs per hour. So we're going to hit OK. Now another 30 minutes has gone by, and we want to titrate this up to our max infusion rate of 100 mLs per hour. What you will do is you'll touch on the 75. You will put in 100 mLs per hour. You will hit OK. It will give you a warning letting you know that you're titrating from 75 to 100 mLs per hour. You're going to hit OK. And then now you are titrated up to 100 mLs per hour, and you can continue your infusion until completion. You will note down here that the time has changed to our total infusion time of roughly 4 hours, minus the initial 20 mLs that we put in there. As you're actively infusing, say your patient needs to get up and go to the restroom and you need to disconnect them for a minute. What you can do is go ahead and hit request pause. It's going to say still running. You're going to hit OK. And then you'll note that the infusion is now paused. You can go ahead and disconnect your patient, allow them to go to the restroom, and when they come back, you can continue that infusion. If for some reason you're stopping the infusion completely, you would go ahead and hit quit, and then it would cancel that infusion. You will note that the pump, after a certain amount of time, will start beeping at you and making a ton of noise. If this happens, it really is much easier to just turn your pump off. Let your patient do what they need to do, and then when they come back, turn the pump back on and then resume where you left off in your infusion. And you'll see that here in just a minute. You will note that if you turn the pump off and then turn the pump back on after the patient has returned and you're ready to continue your infusion, it will say the pump was turned off during an infusion. Is it okay to continue with the previous infusion? You'll go ahead and hit OK. And then that pump will go ahead and load or resume where it had left off. In this case, we're going to go ahead and hit request continue. Still paused, OK. Now you will note that the infusion is now continuing to infuse. So it's a good thing to note that if you have to disconnect your patient or pause your infusion for extended amount of time, it's better to go ahead and just turn the pump off, then turn the pump back on, and then resume where you left your infusion off. Continuous infusions are extremely nice, and titrating on the continuous infusion setting is very convenient as long as you are paying attention and titrating at the correct times. Now we're going to move into how to program a multi-step infusion where the pump will titrate for you automatically. Now you can see that we are in the continuous mode for our infusion. Now say you want to program this pump to do the multi-step program and then have the pump titrate for you. What you're going to do is you're going to have this, if you're in the continuous mode, you're going to have to go to options, and then you're going to hit delivery mode. And this is very important with this pump. Anytime you're changing any settings or doing anything, there is a code to do that. The default high level code is always 7770. You hit OK, and then you get to this screen. This allows you to select the different delivery modes. There's only 2 delivery modes that we will ever use with this pump with Finnick Health. You're either going to use continuous or you're going to use multi-step. In this case, we want to change from continuous to multi-step. So you'll select multi-step, and then you'll see that the color changes on our infusion button, and then it also changes up here to multi-step. That is how you know that this has changed into the correct infusion mode. Now, when you're in the multi-step program, the reason that you would want to use this is if this is a very consistent patient, they use the same program, the same titration rates continuously. They don't change. They're very stable on their titration rates, and rarely do you ever have to deviate from the titration rates that you use continuously. In that case, programming your pump with a multi-step infusion can be beneficial because, again, the pump will titrate for you, and it just makes it easier with those very well-established patients. If this is a new patient and you're unsure how they're going to tolerate their infusion, the continuous mode may be a better option. But again, for patients that are very well established and have been on service with us for quite a while, programming the pump for multi-step infusion can sometimes be a little more beneficial for you as the nurse. Some tips and tricks when you are utilizing a multi-step infusion. This is optional and not something you need to do. If you don't want to do this step, go ahead and just skip ahead and watch how to program a multi-step infusion. But if you want to make this a little bit easier for yourself, you're going to go to options. You're going to select pump configuration. Then you're going to select General Settings. Then you're going to hit Startup Configuration. And you'll notice when you go into Startup Configuration, you can, the last, repeat last infusion is already on, typically, which means that like the Curlins, you can go ahead and just select the last program that was utilized on that pump. But what you're going to do in this case is we're going to hit pre-program and we're going to turn it on. Then we're going to hit OK. Then we're going to hit OK. And now you'll notice that a new tab has opened up for us on our home screen. And what you're going to do is you're going to hit the preset programs. You're going to create new. We're going to put in our password, 7770. You're going to hit OK. Then you're going to come up with a name, something simple. And this is like old school texting, before they had smartphones where you can swipe to text. In this case, we're just going to put IG. Then we're going to hit OK. And then we're going to go into programming our multi-step program. What you would do is go ahead and hit mLs. No, this is not weight-based. We're going to do mLs per hour. We're going to select how many steps. So we're going to use the same example. We're going to start at 25 mLs an hour, go up Q30 minutes to a max of 100 mLs per hour. So in this case, we're going to put 4 titrations or 4 steps. We're going to hit OK. And then we're going to program our first titration. Our first rate is going to be 25 mLs. Our volume, and then our time is going to be 30 minutes. Then you're going to hit OK. And you'll note, like on the Curlins, that if you put in your rate and your time, it automatically calculates our volume to be infused. Then you're going to go ahead and hit OK. And you're going to put in your next titration, which is going to be 50 mLs for 30 minutes. You're going to hit OK. Then we're going to go to our third titration, which is going to be 75. And then for 30 minutes, you're going to hit OK. And then this is our last titration. So what we're going to do is we're going to put in our rate of 100. And then we're going to put in our total volume. So in this case, just do, say we're doing, again with the same example, we're going to do a 40 gram dose or 400 mLs. I'll just put in 400 mLs and then hit OK. And then it'll automatically calculate our time. Then what you're going to do is hit OK. And then this gives us our total infusion. So in this case, if you're a perfectionist and you want it to be closer to your total volume, actual volume, so in this case, we're at 475 mLs. What you can do is actually go back and then subtract 75 from that. Typically, you always want to go a little bit over what your actual volume is. What I would put in here is 340. Hit OK. And now you'll notice that our total volume is much closer to what our actual volume is going to be. So we got 415 mLs total, which is just a little bit over what our actual volume of 400 is. Then we'll hit OK. Then you'll see that the program was saved successfully. And then we'll hit OK. And then you'll see here that our IG program was saved. The nice thing is though, when you go into your patient and you want to use the multi-step function, what you will do is instead of creating a new infusion and reprogramming that over and over again, you'll go into your preset programs. Then you will select your program. You'll verify that it's accurate. You'll hit OK. Then you'll hit start. And now your infusion is running at your programmed titrations and rates. This makes life much easier when you're utilizing the multi-step function with those very well established patients that really don't have their infusions change or their rates change very often. Now, say you don't want to create a pre-infusion program and you just want to program a multi-step infusion like normal. What you will do is you'll turn your pump on and you will come into your multi-step program. Then what you will do is you'll hit new infusion. You'll hit mLs. No, this is not weight-based. You'll hit mLs per hour. Then you're gonna select the steps or how many titrations we are gonna make. Again, in this case, we're gonna use the same example. We're gonna start at 25 mLs, go up by 25 mLs every 30 minutes to a max of 100 mLs. So in this case, we're gonna have 4 titrations. You'll hit OK. And then on this first screen, you're gonna go ahead and put in your first rate, which is gonna be 25 mLs. And then you're gonna skip your volume and go to time. And then you'll put in 30 minutes. Then you'll hit OK and go to the next titration. And you'll notice at the top here, it says step 2 of whatever. So you're gonna go in, select your second rate. You're gonna do 30 minutes. Then you go to your third titration, which is gonna be 75 for 30 minutes. Okay, and then on your last titration, you're gonna put in your last max infusion rate. Then what you're gonna do is put in your volume. Like you do on the Curlins, you're not gonna put in your time, you're gonna put in your total volume. So in this case, you wanna do, say this is a 40-gram infusion and the total volume is 400 mLs. What I would do is just put in 400 mLs, then hit OK. Then you're gonna hit OK. And on this last screen, it'll say, okay, your total volume is 475 mLs. So if you want to get that a little closer to your actual total volume of 400, what you're gonna do is you'll hit back and we're gonna change this volume to something that's a little bit closer and subtract that 75 basically off of it. So in this case, I'm gonna do 340. We're gonna hit OK, hit OK. And you'll notice now that our total volume is 415 mLs. Then you'll hit OK. You'll hit start. And then your infusion will begin. Now we're going to talk about some settings that will make your life as the nurse much easier with this pump. When you turn your pump on for the first time, you're going to be into your screen, either your continuous or multi-step program. Then what you're going to do is you're going to hit options and you're going to go into pump configuration. Then the first thing we're going to go through is the alarms. So you'll go into alarms and you'll notice that this will be already defaulted into the pumps when you receive them, but our unit inclusion units are going to be PSI. It's going to be set to the highest PSI possible with this pump is going to be 17.4. If you're with a pediatric patient and you're concerned about it, you can go ahead and change this and you can go down to as low as 5.8 or up as high as 17.4. You can also change the pump unattended alarm. Again, you can go 2, 5, or 10. I recommend always putting the most. The infusion near end, you can set that as well. So the pump will alarm as you get close to the end of your infusion, so you know when your infusion is starting to end. You can turn that off. And then the alarm volume, you can go ahead and change that too. It's either maximum or minimum. It will always be default to the maximum typically. I recommend always putting it to minimum. These pumps are extremely loud. Then we're going to go into the audio settings and the key volume, which it will be defaulted. So every time you touch something, it will make a noise. You'll notice that the key volume is off on this. So I recommend, it always defaults to being on, I think, low or high, but it makes noise every time you touch it. In my preference, I prefer that to be off. And then again, the alarm volume, I will typically always set it to minimum because these pumps are extremely loud, or can be extremely loud. Then you're gonna go ahead and hit OK, and it'll save it. You go back into your options, do pump configuration, general settings, and you're gonna do there's the startup configuration, which again, if you're gonna do the pre-program or create a pre-program for your multi-step infusion, this is where you'll go ahead and turn that on. You always wanna make sure that you have your authorization level set to high. That gives you the permission in the pump to change things as you need. Now, every pharmacy is a little different. With some pharmacies, they let us program it and set everything up. Other pharmacies will send this pump pre-programmed and will have everything set the way that they want. You as a nurse will know about what the pharmacy would like with that infusion or with their patients prior to utilizing their pumps. After that, you're gonna see the set prime volume. And the nice thing about this is you can go ahead and set how much volume is primed when you hit that prime button. If you remember, when you hit prime, there was 2 minutes set. So on the setting now, it will prime 20 mLs. But remember in the beginning when we were talking about the micro bore tubing with the IVIG, that tubing only takes about 5 mLs to prime, or total volume within the tubing. I would always recommend priming or setting the priming to be a little bit more than your total volume for the tubing. So in this case, with that tubing, I'd probably set it to say 10 and then okay. And the nice thing about changing this is it creates a situation where you don't over prime your tubing and then waste drug by over priming. You can turn your backlight on or off. And then the rest of these, honestly, I wouldn't mess with. Really the big thing with the settings is really just adjusting the alarm volumes and when things alarm. That will make your life much easier in the home so that you're not listening to this pump alarm at you and beep at you, and your patient doesn't have to listen to this pump alarm and beep at you. And if it does alarm and beep at you, it's a little bit less loud. This pump is, again, on the loud settings, is extremely loud and can be very obnoxious, especially if a patient's trying to sleep. I'd like to quickly touch on charging your pump. Now, planning for charging with the Sapphire pumps is extremely important because the Sapphire pumps do not use replaceable C batteries like the Curlin pumps do. The Sapphire pumps, it is very important to plan on charging that pump with the included adapter. Typically with this pump, I will always have the pump plugged in while I'm actively infusing that patient so that my pump is always topped off and fully charged. That being said, with a full charge on this pump, you should be able to do a 4 to 6 hour infusion with no problems. But it's always good to plan for making sure that your pump is plugged in and fully charged while you're actively infusing the patient. When you have your charge adapter, you will notice that there is a metallic side that has a red dot on it. That red dot will correlate to the bottom of your pump, and you will notice that there is an arrow on the charge port. You will line that red dot up with that arrow and then push straight in until it's fully inserted. When you're trying to remove this from your pump, it is very important that you do not twist, rotate, or force this out. There is a collar on this metal piece that you need to pull back on to remove it from the pump. You will notice that that collar moves back and forth. When you want to remove this from the pump, you need to pull that collar back and then remove it from the pump. Hey guys, we're coming to a close of this video. Thank you so much for taking the time to watch this. Hopefully this answered a lot of questions as far as how to utilize this pump. For my Finnick Health nurses, please reach out to your nurse managers if you have any questions. For anybody else that is watching this video, video is not meant to replace the manufacturer guidelines or meant as medical advice. Please reach out to your organization's education department or educator if you have any further questions about this pump. I hope this finds you well, and thank you again so much for taking the time to watch this video.